A patient today asked about options for medical management of an alcohol use disorder. They were unsure whether they could drink in moderation, and also wanted to hear about options that would potentially prevent them from drinking at all. Many individuals don't realize that there are several medications that can really help individuals with alcohol use disorder. And some of the main ones that I wanted to quickly discuss are naltrexone, acamprosate or Campral, and Antabuse or disulfiram. Naltrexone is actually an opiate receptor blocker, and even though it's an opiate receptor blocker, individuals who take this medication once a day, it tends to really decrease cravings for alcohol in a lot of individuals who take it. So someone who says, I still want to try to drink in moderation, when they take this medication each day, they may find that they have fewer cravings for alcohol, or when they drink, they may say, I really don't tend to drink as much, or I don't really feel the urge to hold my drink, or I notice that I put it down for longer periods of time without drinking it, and end up drinking a lot less. So naltrexone is certainly an option, and that medication, when people start it, sometimes they have a little bit of upset stomach or other side effects, headache, just feel a little bit off. Those side effects tend to go away with a little bit of time as you adjust to it. As I mentioned, most people who take it every day who take that medication, but in Europe, it's a little bit more common, and I certainly have some patients who will take it as needed. So they might say, there are only a couple of times a year when I feel like I might be vulnerable to drinking too much, and those situations might be at weddings or certain holiday gatherings where I'm around certain people, and so I'll take that medication before those types of events. Acamprosate is another medication that's sometimes used to decrease cravings for individuals with alcohol use disorders. And although the exact mechanism of action of this medication isn't really fully understood, we believe that it affects the excitation of neurons and may work through GABA and glutamate in the body. I don't tend to use this medication as often, but it has been something that's helped a couple of patients here or there, and it tends to be relatively well tolerated. Antabuse or disulfiram is a medication that actually really should prevent the use of any alcohol, of any drinking for someone. When you take it, it makes it so that you actually can't break down alcohol the way that you normally would be able to, and the alcohol metabolites will actually build up in your system and can make you rather sick. It can actually be really dangerous to drink when you take that medication, and so someone who's conditioned to really enjoy drinking alcohol, while you should never drink if you take Antabuse or disulfiram, if you do drink it, some people will say, I got so sick that I never ended up drinking again, or I really thought twice about drinking. I had stopped thinking about it as a pleasurable activity. For some patients, knowing that they're taking a medication every day, like Antabuse or disulfiram, where they really cannot drink if they take it and could seriously hurt themselves if they drank and they took it, will be enough to decrease the anxiety that they have about their drinking, about their alcohol use disorder. So it actually took a lot of pressure off me because now I don't have the option to drink. And for some people, that can really be a helpful thing. If you believe this video pertains to you in any way, please be sure to talk to a mental health professional directly.